The influence of substances on brain health. Our daily consumption and exposure to various substances can significantly affect brain health. Among these, caffeine, alcohol, and mercury stand out as neurotoxic compounds that contribute to neural damage and a decline in mental well being. Caffeine, for instance, triggers the body's crisis response mechanisms by stimulating neurotransmitters such as dopamine and acetylcholine while suppressing adenosine. While it initially provides alertness and pleasure, prolonged consumption can deplete and disrupt these neurotransmitters, leading to caffeine dependence and withdrawal symptoms. Gradually reducing caffeine intake is advisable to mitigate potential negative impacts on mental health. Mercury, a potent neurotoxin, poses a serious threat to brain health by damaging brain cells and the myelin sheath. Found in certain vaccines, larger fish due to bioaccumulation, and dental fillings, mercury accumulates in tissues over time. It is prudent to check vaccine ingredients and consult a biological dentist who uses the SMART method to remove mercury-containing fillings for preventative measures. Alcohol, another neurotoxin, lacks a safe dosage for consumption. Historical observations during the Prohibition era in America indicated a significant decrease in mental institution occupancy and incidents of domestic violence, highlighting alcohol's detrimental effects on judgment and reason. Legal and illegal drugs alike can affect the brain, potentially leading to conditions like depression and schizophrenia. Some medications, such as antidepressants, may paradoxically induce the conditions they aim to treat. Moreover, certain drugs can adversely affect the prefrontal cortex, critical for higher cognitive functions. Additionally, electromagnetic fields, EMFs from various sources including laptops, monosodium glutamate, MSG, household chemicals, and mold, can negatively impact brain health. MSG, an excitotoxin commonly found in food, can overstimulate nerve cells, enhancing food flavor, but potentially damaging these cells in the process. Adopting positive lifestyle and dietary changes can significantly improve brain health. Decreasing wheat and caffeine intake, avoiding foods containing refined sugar, and limiting dairy consumption are crucial steps toward enhancing mental well-being. Practicing mindfulness about dietary choices is essential for optimal brain health. Stress and worry can circumvent the prefrontal cortex's function, detrimentally affecting mental health. Cultivating trust in a higher power and reducing worry is vital for maintaining good mental health. Embracing peace and living in the present moment involves conscious decisions to let go of past and future worries and fears. Maintaining a positive mental attitude is paramount for brain health. Prolonged stress, anxiety, or negativity can lead to the release of harmful hormones like excess cortisol, which can damage the brain. Mindfulness, meditation, psychotherapy, and cognitive behavioral therapy are effective tools for fostering a positive mindset and reducing stress. Similarly, nurturing a strong spiritual connection can enhance brain health. Studies have shown that spiritual practices such as prayer, meditation, and religious study stimulate the brain's frontal lobe, improving cognitive function and emotional well-being. Pharmacokinetic interactions. Pharmacokinetic interactions occur when supplements affect the absorption, distribution, metabolism, or excretion of drugs in the body. These interactions can alter the concentration of drugs in the bloodstream, leading to changes in their effectiveness or toxicity. This often occurs because both the natural substances and synthetic drugs are designed to address the same issues. 2. Pharmacodynamic interactions. Pharmacodynamic interactions occur when supplements directly affect the pharmacological actions of drugs in the body. These interactions can result in enhanced or diminished drug effects, potentially leading to adverse reactions or therapeutic benefits. Absorption. Supplements can influence drug absorption by altering the gastrointestinal environment or competing for absorption sites. For example, calcium supplements can reduce the absorption of certain antibiotics like tetracyclines when taken simultaneously. Distribution. Supplements may affect drug distribution by binding to proteins in the bloodstream or altering tissue distribution patterns. For instance, St. John's wort is an herbal supplement that has chemical constituents that can regulate hormones and has been shown to reduce mood swings, depression, and anxiety. It can induce the metabolism of drugs like warfarin, reducing their efficacy due to decreased plasma concentrations. 3. Metabolism. Supplements can modulate drug metabolism by inhibiting or inducing metabolic enzymes in the liver or other tissues. Grapefruit and grapefruit juice, for example, can lower blood pressure by improving arterial flexibility, but it can also interact with some blood pressure medications and cause serious side effects. Grapefruit contains compounds that inhibit cytochrome P450 enzymes, leading to increased blood levels of certain medications like statins, resulting in an elevated risk of adverse effects. 4. Excretion. Supplements may impact drug excretion by altering renal function or competing for renal clearance pathways. Cranberry supplements, for instance, have urinary acidification properties and are renowned for their ability to promote urinary tract health and prevent bladder infections. Therefore, they can affect the renal excretion of drugs like methotrexate, potentially leading to increased toxicity. Understanding these types and mechanisms of supplement and drug interactions is essential for naturopathic practitioners to ensure safe and effective treatment outcomes for their patients. By considering the potential interactions between supplements and drugs, practitioners can optimize treatment plans and minimize the risk of adverse effects. Now, let's discuss the importance of the classification of drugs, their interactions, contraindications, and resources for practitioners in clinical naturopathic practice, emphasizing their impact on patient health outcomes and safety. Client and patient safety. Knowledge of food drug supplement interactions helps prevent adverse reactions and potential harm to patients, ensuring their safety during naturopathic treatment. Optimal treatment efficacy. Understanding interactions and contraindications allows naturopathic practitioners to tailor treatment plans effectively, maximizing therapeutic benefits and improving patient outcomes. 3. Individualized care. Awareness of interactions enables naturopathic practitioners to provide individualized care by considering each patient's unique health status, medications, and dietary supplements. 4. Prevention of complications. Identifying potential interactions and contraindications early on can help prevent complications and minimize the risk of adverse events, enhancing the quality of patient care. 5. Promotion of holistic health. Integrating knowledge of food drug supplement interactions aligns with naturopathic principles of treating the whole person, addressing underlying causes, and promoting holistic health and well being. Food drug interactions. Certain foods can interfere with the absorption, metabolism, or efficacy of medications. For example, grapefruit can interact with statin drugs, such as atorvastatin and simvastatin, used to lower cholesterol levels. Grapefruit contains compounds that can inhibit CYP3A4, the enzyme responsible for metabolizing these statins, leading to increased drug concentrations and an elevated risk of statin associated side effects, such as muscle toxicity. 2. Drug supplement interactions. Some dietary supplements may interact with medications, either enhancing or reducing their effects. For instance, St. John's wort, a popular herbal supplement commonly used for depression, can induce the activity of drug metabolizing enzymes and reduce the effectiveness of certain medications, such as antidepressants and oral contraceptives. 3. Supplement to supplement interactions. Combining multiple dietary supplements can lead to interactions, resulting in adverse effects or reduced efficacy. For example, when combining blood thinning supplements like garlic and fish oil, while taking anticoagulant medications can increase the risk of bleeding. 4. Supplement drug interactions. Similarly, ginkgo biloba, an herbal supplement commonly used to improve cognitive function while increasing circulation, can interact with anticoagulant drugs such as warfarin and aspirin. Ginkgo has been shown to inhibit platelet aggregation and may potentiate the anticoagulant effects of these drugs, increasing the risk of bleeding complications. 5. Drug-to-drug interactions. One common example of drug-drug interactions involves the consumption of alcohol alongside prescription sedatives, leading to compounded effects and heightened risks. Alcohol, a central nervous system depressant, can exacerbate the sedative effects of prescription medications like benzodiazepines and barbiturates. This combination can result in excessive drowsiness, dizziness, impaired coordination, and slowed breathing. Moreover, concurrent use of alcohol and sedatives increases the risk of overdose and respiratory depression, which can be life-threatening. Other examples of drug-to-drug interactions include nonsteroidal anti-inflammatory drugs and anticoagulants. Nonsteroidal anti-inflammatory drugs, NSAIDs, like ibuprofen, can interfere with the blood-thinning effects of anticoagulants such as warfarin, leading to an increased risk of bleeding. Statins and grapefruit juice. Grapefruit juice can inhibit the metabolism of statin medications, resulting in elevated blood levels of the drug and an increased risk of side effects such as muscle pain and liver toxicity. SSRIs and triptans, selective serotonin reuptake inhibitors, SSRIs, used to treat depression can interact with triptans, medications used for migraine relief, increasing the risk of serotonin syndrome, a potentially life-threatening condition characterized by agitation, hallucinations, rapid heart rate, and high blood pressure. Understanding food-drug supplement interactions and contraindications is crucial for naturopathic practitioners to ensure safe and effective patient care. In addition, it's crucial to recognize and address potential drug-to-drug interactions to ensure safe and effective treatment for patients in holistic and integrative healthcare.